wind out of the sail of the Director General, but I assure you it is nothing to worry about. A lot of good news on the way. So I will yield the podium to the Director General shortly, but before I do so, permit me to acknowledge some dignitaries who have joined us this afternoon for this all important exercise. We have the head of disease surveillance at the Ghana Health Service, Dr. Dennis Laye, with us this morning. We acknowledge you, Doc. We also have the Director of Public Health, Dr. Franklin Asiedu Bequin, with us this morning. With us also is the Global Health Security Program Director of U.S. Government CDC, Dr. Danielle Baradas. If you are here, we acknowledge you. We also have with us the Health Advisor to FCDO. FCDO is the Foreign Commonwealth and Development Office of the UK, Ms. Uzuamaka Gilpin. Thanks for coming. We also have with us the Country Director of the U.S. Government Center for Disease Control, Dr. Tony Au. Thanks for coming. With us is also the World Health Organization representative to Ghana, Dr. Francis Kasolo. And as I mentioned already, we have a very special guest, the Presidential Coordinator of COVID-19, Dr. Asamoah Ban, with us. And also our speaker for today, Dr. Patrick Kuma Abuaje, the Director General of the Ghana Health Service. So without wasting my time, I will invite Dr. Patrick Kuma Abuaje for his substantive presentation.
Thank you very much, Honorable Deputy Minister. Like the Deputy Minister said, we have good news for you. I will tell you the story how we got to where we are. And I want to stand on existing protocol and acknowledge all our partners who are here, the media, for joining us this afternoon. We are here to talk about the end of the Marburg virus disease outbreak. And we'll talk about the background, how it was the outbreak response measures that were put in place, a bit of the survivor who recovered, actions taken towards the post-declaration conclusion, and then we made a final declaration. Ladies and gentlemen, on the 28th of June 2020, 2 suspected viral hemorrhagic fever cases were notified to health authorities at the Ashanti Regional Health Directorate. That's in Kumasi. The first case presented to a health facility in Adansi North with symptoms onset on the 24th of June. He arrived from the Western region to Ashanti region where he came to seek care. He sought care at the hospital on the 26th of June and died on the 27th of June, that's the day after reporting. A second case also sought care at the same hospital. He came from the Bekwai municipality as a first case, 28th of June, but also died on the same day. Blood samples were collected for both cases and sent to Noguchi Memorial Institute for Medical Research for testing. On the 1st of July, both cases tested positive for Marburg virus, PCR. Both samples were sent to the labs for additional labs in Dakar, Institute Pasteur, for quality assurance purposes, because that was the very first time we had actually gotten Marburg in Ghana. The second case was not confirmed. Subsequent tests showed that it was negative, so that left us with one case at a time. The first case was a 26-year-old male resident in Adansi Kusa in the North region who presented to the health facility with a 3-day history of illness. He was vomiting, he had bloody diarrhea, a history of fever, he was feeling cold, or general body aches, he was having pains on urination, bleeding from the nose and mouth, and had reddish swollen eyes. These are all very clear signs of a hemorrhagic fever. 2 more cases were confirmed after that, a 14-month-old boy and a 24-year-old woman. Both cases are related to the first case. The 14-month-old was a son, and the 24-year-old lady was the wife of the very first case who died. These cases affected 3 regions: Ashanti, Savannah, and Western region. I'll take you through how it happened. If you look at the first slide, the case presented at Adansi, that's where we found the first case. But we realized that he was ill from Western region, precisely Pristia Huni Valley district, and moved to Ashanti for treatment. By the time the results came in on the 1st of July, the body had been buried in Solatuna Kaba, where the disease hailed from. So within that period, that means that we had 3 regions were areas where we needed to focus on: Savannah, Sobatamba, and the Savannah region, Ashanti, and Western region, and specifically the district I mentioned. So if you look at Solatuna Kaba, apart from the fact that part where the burial took place, we had 2 cases were diagnosed from there, and that's where the burial also took place for 2 cases. We also have the Adansi North District as the place of residence for the case 1 who had returned from Western region. And I talked about the fact that because we had the initial second case from Bekwai municipality, we had contacts. Despite the fact that we had tested negative and the quality assurance, we continue following their contacts, and that's why they still remain on the list, to be sure that we don't miss anything. So the Western region is where the first case actually working there as a farmer, and that's where he fell ill. So that became a very crucial point for us as part of our response. We suspect that that's where the virus must have been coming from. But when we visited, we also realized that we also had all the ingredients of the virus. We have the bats were there were old caves, and some mining activities going place. So that meant that it was a very fertile ground for such things to take place. And there were other migrants who had come in there, working there. So these were all areas that created a challenge. So what response measures did we put in place? As soon as we found out that we had that challenge, we issued alerts to all our health facilities, including teaching hospital, that we have identified such a case, just to create the awareness and people to be on alert to look out for them. We also had to activate the national, regional, and district public health emergency structures. This is not limited to only the place. This is a nationwide response, so we just alerted all of them. We also had a deployment of national, regional, and district public health emergency response teams. These are teams that are already there, but we only have to deploy them when there are cases there. We also initiate our risk communication and community engagement about Marburg virus across the country, not just in the district. And we also initiated a nationwide sensitization of all clinicians, that is doctors, health workers who are seeing cases. We also have specific interventions for the affected regions and districts, and these included activation of the regional public health emergency management committees for Ashanti, Savannah, and Western, more of an enhanced activation of the district public health emergency management committee in the affected districts, that is Adansi North, Bekwai municipality, Solatuna Kaba, and Pristia Huni Valley. For these districts, we also had further to do contact identification. We were tracing and following up contacts. We had about 198 contacts, 50 in Ashanti, 84 in Western, 64 in Western, And out of that, we had about 28 were health workers. And the most important information here is that when you have such cases, those who are at higher risk are the health workers, the first responders who are likely to come in. Fortunately, nobody developed the disease, and even though we followed them all for 42 days, despite the fact that the official recommendation is 21 working days to make assurance double sure, we followed all our contacts for twice the incubation period, which is 42 days. We also had training and deployment of community-based surveillance volunteers to go into the communities and look for what is happening, provide education, and also report anything unusual that they see in the communities. We also had the area of case management. That is those who manage the cases. First was the clinical. They went on to review clinical records review of the clinical or the facilities in the locality that we are working in. So, for example, in case someone may have missed something, you go into the records and see all the cases, see what were the symptoms, in case someone missed it, so that we can follow up. We also had provision of psychosocial support for the affected individuals, their families, and their health workers. I mean, if you just even hear that you've been a contact of a case of Marburg viral disease, it's something that requires some psychological support. We did it for the health workers, the families, everybody was done, that including those who were positive. We activated existing treatment centers, specifically in the regions where we had cases, Sola, Savannah, Ashanti, and Western region, and mobilized logistics in terms of PPE, etc., if there were need to use. So we had a single surviving individual. A brief about her is that she was a 24-year-old female related to both the index case, that's the case, the first case, and the person who died. And a child. That is her child, her son. She was tested as a close contact to the index case and the child. She was initially asymptomatic at the time that we took the sample, but was positive, even though it was positive on the 19th of July, 2022. She was isolated following the positive test results, and all her contacts were identified and followed up. She later developed mild symptoms, and so moved her to a designated government treatment center in the Western region. 3 weeks subsequent to that, we had 2 tests done on the 3rd and the 5th as per protocol. On the 3rd of August, it was negative. A repeat 48 hours later, still turned negative. And so she was discharged on the 5th of August as 2022. That is Marburg free. So what have we done? That was the very last case. And subsequently, none of the contacts had developed anything that required anything to worry about. So, the WHO policy is that WHO recommends 42 days following the negative PCR test result at a time for declaration of the outbreak that the outbreak is over, in the absence of new cases supported by evidence of active surveillance and for Marburg virus disease. So, basically, that is the next policy that we are trying to work on. First is we're going to start accounting, and we're going to enhance surveillance to make sure that we don't miss any case, and then we can now declare the outbreak over. So following the discharge of the single case, in the absence of any new case, the countdown for this declaration started on the 6th of August, 2022. We had implemented additional measures as part of the action to culminate the final declaration of the outbreak. And these were included enhanced surveillance and active case search. We're not just waiting, counting, we're actually working and making sure that we're watching, looking out for any case. We all tested all suspected cases, and I'll give you the details later. We We also enhance our risk communication and community engagement to ensure that we are able to protect people and also identify cases. And we have a nationwide, continue the nationwide sensitization of clinicians and healthcare workers across. From the 6th of August 2022, as a way of confirming that they were active stage, we had actually 20 suspected cases who all tested negative for the virus. So that was a real indication that countrywide they were being tested. We also had some suspected cases reported in 15 regions out of 16 regions, showing that the activation of the surveillance system was working, and everybody were actually looking out for these cases. But they all tested negative out of the 91, and post 5th of August, we still found about 20 more cases that we had to test, and they all tested negative. Ladies and gentlemen, in conclusion, Ghana's first outbreak of Marburg virus disease was rapidly detected, communicated, and contained. And I'm sure the communication took place from here with a press briefing, etc., to alert the world we didn't hide it. Appropriate public health response measures were implemented with support from our partners, and we must acknowledge all of them. Having a ecological and animal studies with wildlife division to map out risk across the country. What we are looking at is that let's look at risk mapping. Where in this country is Marburg disease at highest risk? So there's a study going to see maybe this spot and these are areas we need to continue watching. And so we are not just leaving it there, we are making sure that we are more better prepared and also prevent any further outbreak. Our resilience disease surveillance system has once again demonstrated the existing capacity to detect and engender appropriate response actions despite the fact that we are dealing with other outbreaks, yellow fever, monkeypox, measles, and still with COVID. So Ghana Health Service, together with our partners under the leadership of the Ministry of Health and all stakeholders, will continue to work towards achieving the public health security in Ghana. So, on this day, what's today's date? 16th of September, I, Dr. Patrick Kumar-Boaji, the Director General of the Ghana Health Service, on behalf of the Minister for Health, Honorable Ku Ajimamenu, together with our partners, do hereby state that appropriate outbreak response actions to Marburg virus disease has been implemented during the 42 days following the last negative PCR results for the sole surviving case in line with recommendations by WHO and best practices. Ghana has therefore successfully interrupted the first Marburg virus disease outbreak and hereby declare that the outbreak is officially over. And I must say that Ghana is safe for all, both Ghanaians and everybody. We want to use the opportunity once again to acknowledge WHO, both technical and financial support, the US government through CDC, the UK government through the FCDO, all other partners, CSOs who supported us, the Wildlife Division played a key role, Minister of Information as usual, you, the media, the local communities and chiefs who were helping us, and the general public. So I want to thank you. Thank you very much. So Ghana is Marburg virus disease free.
I promised you some good news, and it was well delivered. We are happy that we are at this stage. And it is my prayer that we will come back here and Dr. Patrick Kumar-Boaji will tell us no yellow fever, no monkeypox. Yes. So keep the good news coming. And thank you so much for the good work done. On that note, we will take some solidarity messages from some key stakeholders, not all of them. So we will start with Dr. Francis Kasolu, the country representative of the World Health Organization.
Thank you very much, Deputy Minister. The Deputy Minister of Information, Director General of Ghana Health Service, Dr. Abwaji, Presidential Advisor on COVID, Dr. Samawaba, officials from the Ministry of Information, Health, and the Ghana Health Service, representatives from partner organizations, recognized colleagues from the US government and the UK government, the media. I would like, on behalf of the World Health Organization, to congratulate the Ministry of Health and the Ghana Health Service for their timely response and rapid containment of the Marburg virus disease outbreak here in Ghana. As you all know, the Ministry of Health promptly notified the World Health Organization about the Marburg virus disease outbreak, and I think this is commendable. They did not hide the outbreak, and this is what the World Health Organization indeed recommends to all countries, that do not hide outbreaks, and we are thankful for that action. Ghana has ensured that this particular disease does not spread beyond its borders. I'm also happy to report that since the time the response to the outbreak from the Ministry of Health and Ghana and partners started, it has been swift, consistent, and very focused. It is heartening that within 6 weeks after the detection of Ghana's first Marburg virus disease, this outbreak has been officially declared over. This has been achieved, as we've heard, through a coordinated response across all pillars of the response. That is the surveillance, strengthened laboratory support, contact tracing, infection prevention and control, case management, and indeed, community mobilization. Distinguished ladies and gentlemen, let me take this opportunity to thank all the health workers at the national, regional, and district, and indeed the community levels, who through their efforts significantly contributed to the quick containment of this outbreak. Ghana, as we've heard, has recently been battling, and again, the surveillance system, as we've heard, has demonstrated that it is up to the task. And I think we need to condemn all contributors to this work, our partners, and indeed the health workers that continue to toil on a daily basis, looking out for the different pathogens that may emerge in this beautiful country. It is also important, ladies and gentlemen, that partnership that has been demonstrated through this response continues to flourish. I'm aware that my colleagues will speak, but WHO, working with the UK government, for instance, will continue supporting the strengthening of the integrated disease surveillance and response, the outbreak investigation, and as we've also heard, we're also both going to contribute to the socio-ecological and the animal study that is proposed to take place here in Ghana. I would like to conclude by stating that WHO is committed to supporting the Ghana Health Service, attain its vision of universal health coverage, making Ghana a safer country against all potential outbreaks. I thank you.
Thank you so much, Dr. Kasolu. A message from the US CDC presented by the country director.
The Honorable Deputy Minister of Information, the Director General of Ghana Health Service, Presidential Coordinator for COVID-19, WHO representatives, all other government officials presented here, and development partners represented here as well. Members of the press, ladies and gentlemen, good morning, or afternoon in this case. It is an honor to be here with you today to celebrate, to represent the United States government to celebrate this important public health milestone for Ghana and indeed for the world. On behalf of our interagency health team, including the U.S. Centers for Disease Control and Prevention, U.S. Agency for International Development, and the U.S. Naval Medical Research Unit, I would like to congratulate the government of Ghana, the Ministry of Health, and the Ghana Health Service for their exemplary leadership to swiftly contain the Marburg virus disease outbreak, which was declared early July this year. Your quick action, decisive leadership, and technical expertise prevented further spread of this extremely dangerous disease to the larger population and therefore protecting and saving countless lives. As soon as the outbreak was confirmed, you all got to work. With U.S. government agencies and other bilateral and multilateral partners in support, the Ghana Health Service took the lead in contact tracing, in laboratory testing, supply chain management, and ecological studies to track and contain this outbreak. It was truly a prime example of country-led and country-owned disease outbreak response. The U.S. government and the government of Ghana have been working together for several decades on addressing critical public health issues by supporting disease surveillance, laboratory strengthening, health communication, supply chain management, and other essential components of a robust and effective public health system. And I believe it is because of this long-standing and trusted relationship that we were able to react so quickly to new challenges, starting with COVID-19, now with Marburg virus disease behind us, and of course, monkeypox is our next challenge. We will continue to work hand in hand with our host government and partners such as WHO, UNICEF, FDCO, and others to maintain extreme vigilance in order to prevent, detect, and respond to emerging health threats in our country. Again, on behalf of the United States government, congratulations to the government of Ghana on achieving this momentous public health milestone on ending the Marburg virus disease outbreak. Thank you very much.
Thank you so much for that beautiful message. On that note, ladies and gentlemen, we will take your questions. If you have any question, this is the best time to ask. The news was good enough. I would have wished that. But maybe in course of the presentation, there was something that caught your attention that you wish you further and better particulars on. Please don't hesitate to ask a question if you have any. Okay, I see no hand. Okay.
Initially, he said the first two
please,
cases.
your name and media house and
right. The name is Justice Lee Adoboy. I report for the Xinhua News Agency. Yeah, he first said there were two initial cases, but one tested negative later. Then he mentioned a child who also had it. What happened to the child? I didn't hear that from. I want to hear it from you, please.
Okay, Agnes.
Doc said they are working to contain other diseases outbreaks such as monkeypox, COVID, and etc. So on us to get an update on rabies, if that's possible. Thank you.
Okay.
Yeah. Yeah, Doc, good afternoon. What must we do as a nation to avoid its recurrence in future? And then secondly, what symptoms must one, or what symptoms do you know that the disease has attacked somebody or someone? Because, you have malaria, you may have the symptoms of headache, that. What do you look out for when you suspect that you have that disease?
Thank you for the question. I take that to be the last question, so we'll go to DG for his responses and also his concluding remarks.
Thank you very much, Honorable Minister. I will answer two of the questions, and I'll get the Director of Public Health to give us a brief of the other diseases that is currently ongoing. I believe that the first question was answered by the public, that the 14-month-old baby died. In actual fact, that's the son of the man who died. So they were very close contact. And the survivor is the wife. So it was actually within that group. How do we avoid reoccurrence? And that's why we mentioned the things we've done. Enhance community engagement so that people will know exactly what to look for and how to prevent that. During the intervention, we did a lot of education. We gave our flyers, etc., for people to look out, to know what to look out for and what to do if they come with such a situation. So those are the things. But the most important thing, the socio-ecological study and the animal study that we are doing. This is going to tell us these are the hotspots that likely we are more likely to get in. So we can also work with our community to ensure that they are better able to protect themselves. We are not ending there. We are also engaging in the sub-region. We can work with other countries in the sub-region to ensure that the systems are in place. I mean, there's a lot of cross-border action, and so when another country can easily come into your country. So that's the next stage that we are also working with other partners, including the African CDC and Western Health Organization, to ensure that other countries in the neighborhood also put in additional system. Now that I'm here, let me see whether I can a bit of the key to make sure that this information is communicated to all. Honorable Minister, near senior Baha, near Kayan say, Bear Busumi no near Chirina, Inya, Yarena friend of Marburg virus disease. Yare be a bar, Moja 2, Hoyashi near daddy. Yare Bonipa, say a canipa, a dua, Mubayan Crondia, you. Say Hayami and San Munini. Yet interested be Ashe, Inyano or Ashanti region, Savannah, and Inyana Ashanti region, but a name say, and baby or free buy, baby or Kusi and Internet Co Ashanti region, Savannah, and in I share to say, oh, why, or my moon, your moon by Shamina, yet the omo to Chama, fancy isolation, the Ecosi, say, for now, Chinsia, Sebea, so when you be a behuno. When you been so on fire and you be any friend of contract tracing. If we and so no, ye who say, Papa no nya be the Odikanya be after we see an honest kunyabi. And on the bucket to a power where the a fit and a busumi mino and so sunyabi. Emma omunina we na Tina Bacopa Akano, Papa no we and ere. Ye de no. Control treatment center share na ntibe na ochinsia na test ni ehunu se afei de yare no afiri no mu na sebe ya beka se yare na fi akra no ya de hihye pi to se hwe se sa na ochinsia na after that time no obia enya bi ana se ya hwehwe ma hu se obia ni bi okroma na hwehwe mu nso no ya hu bi okrom ha babia ye no across the country here be nipa be 91 a omo ye say ase omo ye nya bi by na ye negative ye after ma me so ye negative no ye nya nipa be aduonu a ya test omo nya so ye negative enti say yare no ya Africana na ne be stress obi a mo no ho ban se be ya bibi e koso bia no we aso ate se be abetimi so ehun ntem na we kire se Ministry of Ghana Health Service near partners in share Ghana no eboa me etimi hunu ade ne ntem ne ehun ntem so a timi etu ase ema obi a ho ban ntem be so e beda obi ase say boy abijama abedru abiadru. Yes. Okay.
Thank you very much. So I think that we asked a question about rabies. Yes, I think 2 days ago, we have reports of some confirmed cases of rabies in Ashanti region. I think as I speak, we have 4 cases of rabies. And rabies is one condition that when you get, the chance of dying is about 100%. So they have 4 deaths reported in Ashanti. Let me say that rabies is actually zoonotic. So it's a combination of the health sector working with the animal sector. So what is being done is that they are actually doing a very extensive communication across these regions, particularly in Ashanti region. And then what we are also doing is they are pushing a campaign to make sure that all dogs are actually vaccinated. I think that we need to look at the ownership of pets. People have pets, dogs, cats, and they don't vaccinate them. So we are pushing that people and get them vaccinated. Also sensitizing our clinicians about the post-exposure prophylaxis, that if you are bitten by a rabid dog, you need to report as early as possible. So that's being done. Just 2 months ago, we had what we call the National Bridging Workshop, whereby the human and the animal sectors are working together, so that we actually try to minimize or actually eradicate rabies from Ghana by the year 2030. We are hoping that the media will help us to achieve that aim. Thank you very much.
Thank you so much for that insightful presentation. I believe there will be an opportunity for us to have a deeper conversation about that subject matter. But at this point, I think that was very sufficient information moving forward. So, ladies and gentlemen, you heard from the Ghana Health Service and their partners. On behalf of all of us, I would like to thank you for making time to join us this afternoon. We can only plead with you that the information that you have received today, you use your platforms, your media houses to spread it so that we can sensitize our population and make sure all of us in this country are safe. On that note, DG, distinguished invited guests, ladies and gentlemen, thank you so much. Good afternoon.